Thank you very much, Health Minister Kweku Ajiman Menu. And for those of you watching us from the comfort of your homes, well, for those of you also watching on social media, we have the Vice President of the Republic of Ghana, His Excellency Dr. Alhaj Mamadu Bawumia, and he will do the formal launch of the COVID-19 tracker. And I believe that we have the Vice President on now. Do we?
Thank you very much, Chairman General, Honorable Ministers of State, Members of Parliament, artists, distinguished guests, viewers on TV, and followers on social media. The media, fellow Ghanaians, it is really an honor to be part of this unique launch of the COVID-19 tracker app for Ghana today. Let me first of all commend the Honorable Minister for Communications, Honorable Mrs. Ursula Owusu-Ekufo, and her team for the hard work that they have done on this app and making it possible for us to launch it in the shortest possible time. Of course, the latest figures tell us that some 1.7 million people have been infected by the coronavirus, and about 107,000 people have died as a result. And this has affected almost all countries in the world, and this is taking place just over the last 6 months. In Ghana, our country recorded its first case of COVID-19 on March 11th this year. Within a space of 1 month, we've gone from 1 case to 566 cases with 8 deaths as at yesterday, April 13th. The impact of this pandemic on humanity and the world economy is enormous, and our country, Ghana, is of no exception. Businesses are shutting down, workers are losing their jobs, and the lives of our dear ones are being taken away. As the President, His Excellency Nana Addo Dankwa Akufo-Addo, has said, our approach in combating COVID-19 is going to be driven by science and data. In this regard, data is the most powerful weapon in our fight against COVID-19. Fundamentally, you cannot fight what you cannot see. So we cannot be groping in the dark. So the data will point us in the right direction. So our focus in Ghana on dealing with COVID-19 has been basically on the 3 T's. You are tracing, you are testing, and you are treating. So tracing, testing, and treatment are the essential pillars for our fight against the coronavirus. In the context of contact tracing, what we are trying to do is to identify all the people who have been in contact with a positive person so that we can test them as well. To do this contact tracing, we have deployed about 450 teams across the country. And what Ghana is doing is very, very important, because Ghana is doing what even the most advanced countries such as the US and the UK are not doing, and in fact many other African countries as well. So even though we're a small developing country, in this particular area of contact tracing to deal with the coronavirus epidemic, we are ahead of countries such as the US and the United Kingdom on this. Secondly, we are pursuing a strategy of aggressive testing. And in terms of testing for the coronavirus per capita, Ghana is, on the basis of the available data we have, Ghana is in the top 20 of countries in the world. And on the basis of this data too, in Africa, for example, we are number 1 per capita in terms of testing. In terms of numbers of tests, South Africa leads, we are second, but in terms of testing per capita, that is per our population, we will be leading, we are leading the continent. In Ghana, as at 11th April, we've tested 37,954 people. If you look at Africa as a whole, the data seems to show that total tests on the continent are under 100,000 people. In Ghana, we've tested 37,954 as at 11th of April. The tests so far are taking place in Ghana at 6 centers. We've increased the testing centers, and these are centers in Accra, Kumasi, and Pont-Tamale. Very soon we will be adding Navrongo as well as the Tamale teaching hospitals as testing centers. But what is significant about Ghana's approach is that we are chasing the virus and trying to get ahead of it. We are not waiting for people to come to the hospital to report sick before we count them as corona positive. If we had not done the aggressive contract tracing that we are doing, we would not have found the 566 cases we have so far, because many of them would not have reported to the hospital as sick people. And this would have meant a much bigger problem for us later on, as more and more people would have been infected. As I said, this is not being done in many countries. So their reported numbers are no doubt an underestimate. In fact, if we had done what some of the other countries like the US and the UK and many other Africans are doing, in terms of just waiting for people to report and then we count them, then our numbers for COVID-19 in Ghana would have been much less than 200. That would have given us a false sense of security. So the launch of this COVID-19 tracker app today is yet another important step by the government to leapfrog technology in finding solutions to the havoc the COVID-19 pandemic is wreaking around the world. We are trying to use digitization to help us in this fight. Many countries, such as the US, China, South Korea, for example, are using this concept of crowdsourcing from phone data to manage and track persons affected by the pandemic and offer health care, and more importantly, to avoid the spread of the virus. Learning from the experiences abroad, such as the South Korean example, His Excellency the President took the necessary steps to pass an executive instrument, the establishment of Emergency Communications Instrument 2020. And the executive instrument's main purpose is to use telecoms data through a shared common platform to fight this pandemic, with tools such as contact tracing, quarantine, reliability, and certain related telephone metadata for the public good. The executive instrument does not in any way empower the President to assume any form of direct control over any telecoms company, more so to determine their operations. Considering that we are seeing an increase, though marginal, in community spread of the virus, the Ghana COVID-19 tracker app could not have come at a better time than now. It would, amongst other things, as the Minister for Communications has already mentioned, it will, among other things, trace contacts of persons infected by the virus through various telephone-related data and to link such people to health professionals. The tracker also provides information about people that were at the same event, the same location, or the same country, or other defined location-based function, as to know where they may have spread as a group over time. The tracker can also provide periodic lists of telephone numbers that are currently or recently have been in certain countries around the world to the Ghana Immigration Service for possible use in determining whom to provide an extra layer of screening. It is also useful in quarantine reliability to assess if certain individuals are required to self-quarantine are actually doing so. So this is yet another weapon we are deploying. Ghana is one of the few countries in the world to deploy such an app, and it will give us advanced information and allow us to respond quickly and treat early. That is why the COVID-19 tracker app is so important now. If you look at the current spread of the pandemic, it suggests that the virus has a mind of its own. It would therefore require innovative ideas such as the application of technology to deal with this pandemic. If Ghana hopes to flatten the curve or to stop the surge in numbers of people being infected of the virus on a daily basis, then this tracker app certainly offers the solution. Therefore, I will encourage as many Ghanaians as possible to download this app. And if you don't have a smartphone, you can use the USSD code. That means if you have a YAM phone, you can go onto your phone and dial star 769 hash, star 769 hash to access the information and to provide some basic information to enable health officials provide the needed support, irrespective of where you are in Ghana. However, the best strategy in fighting the pandemic is to stay at home and observe all the World Health Organizations and the Ghana Health Service protocols, such as covering your mouth when coughing and sneezing, as well as regularly washing your hands with soap and under running water. Let us continue to adhere to these preventive measures to avoid the spread, save lives, and also help our dedicated frontline health workers who are working tirelessly to save us. On this note, I wish to commend all those who work so hard to make this happen in such a quick time. It is my singular honor to formally declare the Ghana COVID-19 Tracker app duly launched. Stay home, stay safe, download the app. Thank you for your attention. May God bless you, and may God bless our homeland Ghana.